And we're going to talk a little bit about non-surgical fat removal, and I think one of the things that I'm trying to overcome is the myth that non-surgical fat removal doesn't work. So I think that is a false myth, whereas probably even 2 or 3 years ago I'd have said, you know, that's probably true. We don't really have a lot of devices that work. And I think the thing that you have to realize as you explore some of these non-surgical options are that it's not a replacement for surgery, and it can't necessarily get you the same results that you could get or obtain with surgery, but it may be a way to improve some of the contour that you have, and in some selected patients it may allow them to get to where they want to be without necessarily having surgery. And again, we're going to talk a little bit more about that. So segueing into the ZERONA, I'll just educate you a little bit about what that device is. So this is a device that uses a low-level laser therapy. So it is a laser, but it's lower energy than some of the other lasers that you're going to see back in our office. And it works by a different mechanism. Low-level laser energy has been out for several decades. It's primarily used in the management of pain as well as inflammation. But what the company has done is, you can see that device, it actually has 5 laser heads. And those are going to target a couple of different areas on your body, and you'll go through a series of treatments over a 2-week period of time. And what we found is that you can lose inches off your waist and your abdomen and even your thighs when you undergo this program. The company did some good data that they did a good study that they submitted to the FDA, and found on average they lost about 1.5 inches or so off the abdomen, a little bit more than 1 inch off the hips, and a little bit less than 1 inch off of each thigh. In our our experiences early, but we found that our results were comparable to that. And I think we've seen the spectrum of results in our patients. About 90% of patients do respond to the device, so about 10% don't respond. And we don't necessarily understand why they don't respond. And we're going to work with the company to try to figure that out. But about 90% respond, and we've seen anywhere from 1 inch off the waist to as much as 5 inches off the waist on certain patients. And it'd be nice to be able to predict who's going to lose that much, but right now we just can't. The way it works is it probably creates a small little hole in the fat cells, which allows some of that fat to leach out, and it's taken up by your body's clearance mechanism and ultimately metabolized in the liver and either used as energy or excreted. So again, I think this is a newer device that's out. There's some pretty good data to support it, and we're certainly excited about it and are happy to be involved in further investigating it with the company.